The following program is rated GE. It is suitable for general family viewing.
Ladies and gentlemen, welcome again to Body Garage, the art of well-being. I'm your host, Dr. Chepsi. Now, today we are talking about a very important aspect of our health, and we are discussing about kidney disease, kidney health. And before we go into the discussion, it is estimated that all over the world, about 850 million people are suffering from this disease, and it happened about 3 million deaths by the year 2019. In Kenya, the World Health Organization estimates about 4,500 deaths from kidney disease, and this is a concerning number because it's estimated that this is going to rise by the year 2040. And it is because of this that we take this initiative here at Body Garage to bring to you this awareness about kidney health and kidney disease. And we have our guest, Dr. Hussein.
Yes.
Welcome.
Thank you very much.
Yes, it's good to have you again.
Yes, my pleasure as well.
Yeah.
Thank you very much for having me.
We had such a discussion almost exactly a year ago.
Yes.
But it doesn't hurt that we keep doing this again.
Definitely it does not. It's always good to keep on reminding ourselves and our people about kidney disease.
Yeah.
Like you mentioned that more than 850 million people worldwide have kidney disease. Our prevalence is 10% of our total population, who is estimated to have some form of chronic kidney disease.
Yeah.
So looking at our census, it was 52 million. And 10% of that is almost 5 million people have some form of chronic kidney disease, out of which almost 500,000 require some form of treatment.
Yeah.
And almost 20,000 require the renal replacement therapy, called either dialysis or transplantation. Yeah. So it is quite important.
So about 5 million people in Kenya have a certain form of disease,
Yes.
of kidney disease, right?
Disease.
Out of this 5 million, 500,000
require treatment.
All right.
To slow down the progression.
The progression
to
of the
end-stage kidney disease.
Okay.
And then currently we have an estimated 20,000 people who actually require the renal replacement therapy who have reached kidney failure.
So about 5,000 people have kidney failure.
20,000.
20,000.
20,000.
Yeah. That's quite a significant number, right?
Yes.
Yeah. All right. We got into the discussion, but Dr. Hussein, where do you practice? Who are you?
So my name is Dr. Hussein Baga. I'm a consultant physician and a kidney specialist working at the MP Shah Hospital, where I had the kidney unit and the kidney transplant unit as well.
Yeah. All right. Now, the discussions about the kidney, but just take us through basically how the kidney is, like its function, where is it located in the body, and so that we can understand.
So normally every person has 2 kidneys, which are basically located at the back where I'm pointing. It's not in the front here like everybody would tell you. They would come to my clinic and say, I have kidney pain, and they would point here. Yeah. The kidney is actually located at the back. And I think even this year the World Kidney Day campaign is to point to your kidneys, take a snapshot, and then post it on their social media sites to create awareness as to where the kidneys are. And as I mentioned, that we have 2 kidneys whose function is very critical. Yeah. They help in removing the poisonous wastes that the body keeps on accumulating and generating. They also help to regulate your fluid balance. Yeah. So remember that all the water that we drink, the water that comes from the food as well, all of this the excess water has to be removed, and all of it is basically removed through the kidneys. The kidneys are also very important in terms of regulating your electrolytes. Now, electrolytes are those tiny chemicals like potassium, sodium, calcium that are very important in our body functions. Like potassium is very important in the heart, calcium is also very important in the heart. They also play a part in the functioning of the muscles of the body as well. So the body helps to make sure that all of those electrolytes are maintained within a certain normal range. The other function of the kidney is to, of course, remove any excess acid that builds up in the body. Now, this acid is different from the acid that you produce in the stomach. This is basically the acid produced in the blood from the various foods that we eat, and also some other chemical reactions that happen in the body. Because if there is too much acid built up in the body, it will affect the functions of the heart and the other organs as well. The kidney is also important in regulating your blood levels or hemoglobin levels. So those patients who have chronic kidney disease, which is at an advanced stage, you find that their blood level tends to be low, and this is partly why they tend to feel fatigued and tired most of the time. The kidney is also very important in controlling your blood pressures as well. And also it produces a hormone vitamin D, which is important for your bones. So you can see that the kidney is very, very important as an organ in the body. It controls very many functions. It helps to regulate your electrolytes, your acid-base balance, and the level of blood as well.
So it's many times when we talk about the kidney to the people who are not medics, the first thing that only comes to mind when we talk about the kidney is urine.
Urine, yes.
But as it is, the kidney has much more deeper functions than just producing urine, right?
Definitely, yes.
So what are some of these common things that will cause problems to our kidneys, especially in our Kenyan context?
So, just like what is happening in the Western countries, the most common cause of kidney disease in our adult population is hypertension and diabetes. Now, unfortunately, we are seeing quite an increase in the numbers of patients who are having diabetes, especially type 2 diabetes and hypertension. And those two are the most common causes of kidney disease in our population as well. The third thing that is now becoming an epidemic, as I would call it, is obesity. You are seeing more and more people who are getting obese, overweight and obese, and obesity causes kidney disease directly as well as indirectly. Indirectly, because of the fact that when somebody is obese, you are at a high risk of developing diabetes and high blood pressure. So indirectly through that you can get kidney disease. And then obesity also directly causes kidney disease as well. So it is important for our Kenyan people to realize that obesity is on the increase here in Kenya as well. And it does predispose them to the metabolic conditions like diabetes and hypertension, as well as chronic kidney disease. Now, if you have a family member who has chronic kidney disease, then it does increase your risk of developing chronic kidney disease. There are certain conditions that are genetic, the most common of which is when you have cysts in the kidney, what we call autosomal dominant polycystic kidney disease. So that is also very common. Of course, living in sub-Saharan Africa, infections, especially HIV, hepatitis B, hepatitis C, also predispose to chronic kidney disease. Unfortunately, when you have maternal complications, when somebody is pregnant and they get hypertension in pregnancy, it also increases the risk of developing kidney injury and subsequently chronic kidney disease. In the elderly males, obstruction to the flow of urine because of prostate enlargement also leads to chronic kidney disease. So these are the most common causes for chronic kidney disease in adults. Yeah.
When we talk about kidney disease in children, what will be some of the causes of the kidney disease in children?
So the causes are slightly different because for children we normally look at the congenital anomalies or malformations, like the kidney is not formed properly, what we call dysplasias, or it is not formed at all, what we call aplasias. Sometimes they have what is called posterior urethral valves as well, which lead to obstructive uropathy, leads to damage to the kidneys as well if it is not picked up on time. Then of course we have glomerular diseases as well that also lead to chronic kidney diseases, and more commonly in the children you have conditions like minimal change disease or some other forms of glomerulonephritis that also leads to chronic kidney disease. So it's slightly different.
Slightly different, all right. Now there are these things that we hear about. Some papers will say there is a rising concern of kidney disease in people living in rural areas, in rural Kenya. What will be the possible cause that is happening? Is it something that is unique that is happening in rural areas, or what will be the issue?
Well, in the rural areas, unfortunately, we have a lot of use of herbal medicines. Okay?
Yeah.
And then once when people start taking herbal medicines for whatever it is, I mean, people want to clean their tummy, as they call it, detoxify themselves,
yes,
or get a good bowel movement, they'll take herbal medicines. If they get a fever, they'll go to the herbalist who will prescribe for them herbal medicines. Now remember that these herbal medicines have not been tested to see what effects they will have.
Yeah.
So I would presume most commonly it's because of the herbal medicines that people are taking.
Yes.
The other thing is that our health-seeking behavior is not the best, unfortunately. So there are very many small pharmacies that are opening up even in the rural areas as well. So if somebody has any pains or fevers or headaches, they will go to the pharmacy whose job is just to give them any over-the-counter painkillers. Unfortunately, some of those painkillers are not good at all, like the non-steroidal anti-inflammatory drugs.
Yeah.
And these cause kidney injury as well. So the other thing is that we always have this assumption that people in the rural areas don't get hypertension and they don't get diabetes. Now, unless if you test yourself, you will never be able to diagnose whether you have high blood pressure or diabetes. And we know that diabetes is more prevalent in the central region of Kenya. Yes, not so much so in the urban area, but in those areas. So unless if we are going to go out, educate our people to go for regular health checkups, especially if they're at risk or if they're more than 40 years of age, you'll not be able to pick up those conditions, which then subsequently lead to chronic kidney disease. Yes.
All right. Now, you mentioned something that I also wanted us to talk on a bit, the relationship between kidney disease and use of medications, not the herbal medications, but the defined drugs that we prescribe. Yeah.
Yes, so there are a lot of medications that are out there in the market. Now, there are some that are quite harmful to the kidney. And unfortunately, these are prescribed even by the doctors, and mainly the painkillers, what we call the non-steroidal anti-inflammatory drugs, like Brufen or diclofenac or indomethacin. So these drugs unfortunately cause quite a bit of harm to the kidneys, and it is worse so when you already have pre-existing kidney disease.
Yeah.
Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
Nikuwe na Nisani kama 10 na pia nikuwe menua minibus. Minibus niko niwa.
Kushinda unaangalia simu ya mzee. Soma Biblia ama ingia kwa washroom ujisugue mpaka nimetoa hivi.
I don't know whether any of my children would want to get into the political field. Sijajua bado.
Kila Alhamisi saa 1:30 kuendelea.
Join us on a journey through the concrete jungles and rising skylines, where every beam, every nail tells a story of progress and vision.
In every aspect of life, you have to look at several dynamics.
From groundbreaking,
Nowadays with the tech, you can check on different websites or you check online and you can see some inspiration. So at least that one would be a direction already. I'll know like what kind of style you're going for.
to finishing touches, witness the dedication of the hard-working teams who bring these ambitious dreams to reality. The Realtor, Tuesdays at 6:30 p.m.
Na safari hii katika Mfahamu Kiongozi
Welcome back. You are watching Body Garage, the art of well-being. I'm your host, Dr. Chebs, and we are discussing about kidney diseases and kidney health. Now, for now, we want to look at a special group of people, Dr. Hussein. Is there a relationship between people who are HIV/AIDS positive, people living with HIV and AIDS, to being at risk than the rest of the people to develop kidney disease?
Yeah, that's an excellent question, and the answer to that is yes. So patients who have, or people living with HIV are at a higher risk of developing chronic kidney disease. Some studies have actually shown that between 20 to 50% of these patients do develop chronic kidney disease. So the reason why are they at high risk of developing chronic kidney disease? Now, one is that the HIV virus itself causes kidney disease because it can cause damage directly to the kidney itself.
Yeah.
Two is, of course, the medications that we are using. Those can also have effects on the kidney.
Yeah.
And then three, when you start getting the opportunistic infections. Now, when you talk about opportunistic infections, we talk about infections that somebody with a normal immunity would not get. So things like TB, things like infections that make you have diarrhea and vomiting, which make you get dehydrated. Those also affect the kidneys as well. There are some infections like the fungal infections that can directly affect the kidney as well. So these patients tend to have a higher risk of developing chronic kidney disease. So it is important for these patients who have or who are living with HIV to have regular checkups for the kidneys as well.
All right.
Yeah.
Now, this is an off-the-cuff question.
Yes.
Can somebody live with one kidney?
Yes, I mean, people do live with one kidney. Some people, as I said, are born with one kidney, and it's only discovered incidentally when we do an ultrasound for whatever other reason it is, and we find that they only have one kidney. And we also have patients who have donated their kidney to their loved ones or to their relatives for a kidney transplant, and they have lived a very healthy life as well. So yes, somebody can live normally with one kidney as long as you take care of it and you take care of yourself. Yes.
All right. Now, what about no kidney?
Of course, you can't live without any kidneys. As I explained, the kidneys are very integral in terms of making sure that your body functions well. And now, once you develop chronic kidney disease, and if you go on to develop kidney failure, whereby your kidneys are functioning at less than 15%, then you have to start looking at what modalities of treatments there are for you. And once when it goes to less than 10%, then you have to start dialysis if you have not yet been offered a kidney transplant.
All right.
Yes.
Wow. So you can live with one kidney as long as it's healthy, but we cannot live without any.
Without, yeah. So
so we have to take care of our kidneys.
We have to take care of our kidneys.
Great.
Yes.
Now, you know, as you said initially, kidney disease, you will not feel any symptoms until probably it's advanced, right?
Yes.
So what will be some of the early signs and generally the symptoms of a kidney disease towards kidney failure?
So the chronic kidney disease, there are stages of chronic kidney disease. There's stage 1 to stage 5. Where stage 5, of course, is end-stage kidney disease or kidney failure. Now, when you're in the early stages, stage 1, 2, and 3, you will barely feel or have any symptoms. You might be feeling a bit fatigued here and there, a bit tired out, more than usual. But there are no very specific symptoms. And of course, in this day and age where we are all hustling, we all feel tired at the end of the day. And you're like, this is because of... Yes, it's very difficult to differentiate it. But as the disease progresses now, when you start going into stage 4, is now when your blood level tends to go down, the toxins start accumulating in your body, you start feeling a bit of nausea, your appetite is lost. And as it progresses, you find that even your urine output goes down. So the volume of urine diminishes in the last stage. And then you find that your legs are getting swollen because of the water retention. You're getting more breathless when you walk because of water in the lungs. And in some instances, you also start having a lot of itching because of the toxins being deposited under the skin, vomiting. And this is now what we call kidney failure stage. Now, unfortunately, for us as doctors, we tend to get patients in stage 4 and stage 5. And where there's very little that you can do to assist apart from now putting the patient on dialysis. I mean, we have had patients who come in crushing because they can't breathe. They're in overt volume overload or fluid overload, what you call pulmonary edema, have to be rushed to the intensive care unit, have to be dialyzed to stabilize them. And this is where we are catching the patients. But unfortunately, we don't need to reach there because this is a preventable thing. I mean, we can slow down the progression of chronic kidney disease with the various medications that we have currently. And the important thing is, if you are at risk of chronic kidney disease, then you need to have regular checkups. So the question is, who is at risk for chronic kidney disease? How do I know that I'm at risk of chronic kidney disease? So you'll know you're at risk of chronic kidney disease if you have diabetes or high blood pressure or hypertension. So if you have diabetes or hypertension, then you are at a higher risk. Remember what I said, that diabetes and hypertension are the single most common causes of chronic kidney disease in Kenya as well as worldwide. Okay? If you have a family history of chronic kidney disease, you are at risk of developing chronic kidney disease. Okay, so you need to go for regular checkups if you have any of these. If you have been taking a lot of painkillers in the past, and now you have watched the show, please go to your nearest healthcare facility, inform your doctor that you just like to have a kidney checkup done. It's important. I mean, it's just a blood test and a urine test that we do, and that is what will assist us in helping you to know whether your kidneys are functioning fine or not. If you have any problems passing urine, especially for those who are more than 50 years of age, and you're getting problems starting to pass urine for the males, or you find that in between your stream is cutting, or you feel that you're not completely emptied your bladder, it could suggest that your prostate is enlarged. So then come to the hospital for a medical checkup. That's the only way that we'll be able to assist you. And if we find that it is there, there are treatments for it, and we can protect your kidneys.
Yes. So it's about early screening and detection, and if it's caught early, then the appropriate measures are taken.
Exactly.
The World Kidney Day 2024, this year's theme is about kidney health for all, right? So what are some, apart from early screening and getting those regular checkups, what are some of the lifestyle modifications that we can employ in our daily practices, daily lives, so that we, in the long term, we are helping protect our kidneys?
So, most importantly is exercise. Exercise is very important. So brisk walking every day for half an hour, at least 5 days in a week. This helps to control your blood pressures, okay? It helps you to lose weight. Remember what we talked about, obesity is very common, is the third most common cause of chronic kidney disease. Eating a balanced and a healthy diet, very important. Let's stay off these burgers and chips and sodas and sausages.
Yeah.
Eat a balanced diet, okay? Eat more of fruits and vegetables, okay? Avoid over-the-counter medications. If you're getting recurrent headaches, ask yourself why. Maybe you have a migraine headache. There are other medications that help to control those headaches rather than just popping Brufens or diclofenacs, okay? Consult your doctor for that. If you have a family history of chronic kidney disease, go for a checkup. If you have diabetes, or if you have high blood pressure or hypertension, make sure that you take your medications regularly. Make sure that you are checking your blood pressures and blood sugars regularly. Go for regular checkups as well. Another important thing is, especially in this hot weather, keep yourself well hydrated. It's very important as well. And by well hydrated, I mean water. This is the best.
Not coffee.
I mean, you can take coffee, you can take the fresh juices. What I meant was alcohol. Please don't go for alcohol and I say well hydrated. Yes, fresh juices are very good. Coffee there's no contraindication to coffee per se, but water is the best. That's what I'll always say. Yeah.
All right. Now, you mentioned a bit about it, but I wanted us to talk about alcohol and cigarette smoking on kidney health.
Yes. So, cigarette smoking is quite dangerous for the kidneys. When you have chronic kidney disease that is already established, when you continue smoking, it does predispose you to go on to develop the advanced stages of chronic kidney disease. Now, this is the direct effects. The indirect effect is, of course, it can affect the heart as well. So when you get a heart attack because of chronic smoking and your heart becomes weak, it also damages your kidneys even more. Yeah? Then there's the aspect of cancers. Smoking has been shown to increase the risk of kidney cancer as well, apart from the other cancers like lung cancer. So for me, unfortunately, smoking should be banned completely. Yeah.
Not even regulated.
Yes, it should just be banned, because I mean it's a sure way of damaging your kidneys, your heart, your lungs. That's a definite way, unfortunately. You asked about alcohol as well. Now, unfortunately, there's no right amount of alcohol to take. The studies have actually shown alcohol generally is bad now. When you take alcohol, whatever the quantity, for up to 4 hours after that, you are at a high risk of developing an abnormal rhythm of your heart. So you can see by that virtue itself, alcohol is not good for you. Yes.
That's quite, because I also came across recently an article that said no amount of alcohol is safe.
It's safe, yes.
So even if you take a sip,
yes,
it's still
dangerous. Yes, it's still harmful, unfortunately. You see, initially we used to say moderate consumption of alcohol, but now the verdict is no. Any amount. It's quite a strong statement out there, but unfortunately we have to say it.
That's the truth.
Yes.
And that is science.
Yes.
Okay. Thank you. Now we are going to take a break, and when we are back, we will pick up the conversation where we have left. This is the last part of our conversation for today, so you don't want to miss this. Stay tuned.
safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
Nikuwe na nisani kama 10 na pia nikuwe menua minibus. Minibus nikoniwa.
Kushinda unaangalia simu ya mzee, soma Biblia ama ingia kwa washroom ujisugue mpaka nimetoa hivi.
I don't know whether any of my children would want to get into the political field. Sijajua bado.
Kila Alhamisi saa 1:30 kuendelea.
Join us on a journey through the concrete jungles and rising skylines, where every beam, every nail tells a story of progress and vision.
In every aspect of life, you have to look at several dynamics.
From groundbreaking
Nowadays with the tech, you can check on different websites or you check online and you can see some inspiration. So at least that one would be a direction already. I'll know like what kind of style you're going for.
to finishing touches, witness the dedication of the hard-working teams who bring these ambitious dreams to reality. The Realtor, Tuesdays at 6:30 p.m.
Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
Nikuwe na nisani kama 10 na pia nikuwe menua minibus. Minibus nikoniwa.
Kushinda unaangalia simu ya mzee, soma Biblia ama ingia kwa washroom ujisugue mpaka nimetoa hivi.
I don't know whether any of my children would want to get into the political field. Sijajua bado.
Kila Alhamisi saa 1:30 kuendelea.
Join us on a journey through the concrete jungles and rising skylines, where every beam, every nail tells a story of progress and vision.
In every aspect of life, you have to look at several dynamics.
From groundbreaking
Nowadays with the tech, you can check on different websites or you check online and you can see some inspiration. So at least that one would be a direction already. I'll know like what kind of style you're going for.
to finishing touches, witness the dedication of the hard-working teams who bring these ambitious dreams to reality. The Realtor, Tuesdays at 6:30 p.m.
Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
Nikuwe na nisani kama 10 na pia nikuwe menua minibus. Minibus nikoniwa.
Kushinda unaangalia simu ya mzee, soma Biblia ama ingia kwa washroom ujisugue mpaka nimetoa hivi.
I don't know whether any of my children would want to get into the political field. Sijajua bado.
Kila Alhamisi saa 1:30 kuendelea.
Join us on a journey.
Welcome back. You are watching Body Garage, the art of well-being. I'm your host, Dr. Cheps, and we are discussing about kidney health and kidney diseases. So, Dr. Hussein,
Yes.
you mentioned that unfortunately in the Kenyan context, many of the people that have kidney failure or kidney disease come while it's quite late. The
Yes.
disease is quite advanced, which is something that is common in most other diseases. So what is happening that this is the case?
So, as we mentioned earlier, unfortunately, in the early stages of kidney disease, there are hardly any symptoms. So, people will just have the symptoms. Most commonly, it is fatigue or getting tired, and they're like, "Yeah, I'll just rest it out. Let the weekend come. I'll feel better. I'll get a good night's sleep. I'll feel better." But it persists. If you talk to the elderly, like those who are 60, 70, they have the symptoms of prostate enlargement. They'll be like, "No, this comes with age, so it's normal. Everybody has it. All my friends have it, so it's nothing abnormal." And you're like, okay. You get people who develop persistent swelling of the legs. And they're like, "Yeah, but it's been happening for a long time, and I sit for long or stand for long." Yeah, most commonly it's because of standing or sitting for long, but if it persists, then you need to have it checked out early. So you see, what happens is we miss that opportunity to have it checked out early, unfortunately, and this is where the problems come in. And then, of course, there's also the economic situations that we're dealing with currently, and somebody might be sick, but then they opt not to see the specialist, but they'll go to a dispensary or they'll go to the pharmacy, and who will give them medications just to relieve the symptoms, but not find out what has caused the symptoms. And that is very problematic. And sometimes when you have pains and aches and feeling tired and a bit of headache, which could be because of kidney disease, and you're given medications that may worsen it, like your Brufen. Yeah, it happens, unfortunately. I've seen a lot of patients that come in with those problems, and when you take a history, they've been taking over-the-counter medications, yes. And unfortunately, by the time they come in, it's a bit late. Yeah, so...
Is there also a challenge about the health system structures and, maybe referral systems, healthcare staff, resource issues, such that the healthcare system is not well equipped from screening level and referral system?
Yeah, so as I mentioned, for the screening, what you require is just a urine test, where you take a strip, it's called the dipstick, put it in the urine, and you check and see if somebody has any proteins or blood. It can be done at home as well. Unfortunately, a lot of our level 1 facilities don't have that. Yes, or even if they do have it, nobody thinks about checking for it. The other thing that we do is a blood test. We measure a certain chemical in the blood called the creatinine. A lot of facilities, government facilities, don't have that. Or they have the machines, but they've run out of reagents. So what happens? The patients are told, okay, fine, do this test, but do it in a private laboratory, where the cost is out of reach for a lot of our citizens. And this becomes quite a challenge for us. Yes. I mean, if somebody were to make sure that all of the level 1, level 2 facilities were equipped with the urine dipstick, and it's a very cheap thing, it saves the government a lot of money if somebody is treated early for the kidney disease rather than much later, because much later means being on dialysis. One session of dialysis costs 9,500 shillings. Somebody has to be on 2 sessions a week, which is 18,000. 8 sessions a month, which is 76,000. Multiply that by 12. So you can see how much money you have to spend on treating somebody who is on dialysis because of kidney failure, and the cost of preventing that person from reaching there is a fraction of that cost. So I would rather that we invest in those equipment, like the urine dipsticks, the machines for detecting creatinine, and detect these patients early, screen them, detect them early so that they don't reach kidney failure. Yes.
Now, what are some of the treatment options for, we will skip specifically to like the chronic kidney disease. You've mentioned some of them, dialysis, transplant.
So when somebody reaches kidney failure or end-stage kidney disease, there's nothing much that can be done apart from now offering them the renal replacement therapies, which is either dialysis or a kidney transplant. Kidney transplant is a preferred modality of treatment because it is much more cost-effective. It improves your quality of life as a patient. It reduces your chances of dying as compared to when you're on dialysis. Dialysis is a very costly affair. There are two types of dialysis. There is one that we call hemodialysis. Hemo means blood, which is what is most commonly available in Kenya, whereby the blood is taken out of the body run through a machine where it is cleaned, the excess water is removed, everything is regulated, and then it's brought back into the body. Somebody has to do it at least twice in a week. They have to have an access, either a catheter or what we call a fistula, whereby the artery is joined to a vein. There's a high risk of infections because of the catheters. Patients have to miss their jobs the days they are on dialysis. So twice in a week, somebody has to be off work. So and then of course there's a cost of the dialysis itself, which the government is bearing currently. So if you are looking at a patient who is being dialyzed vis-a-vis a patient who is being transplanted, by the third year of transplant, you're actually making savings for the same patient who would have otherwise been on dialysis. Because after the transplant, the patient has to be on anti-rejection medications. The anti-rejection medications per month cost 40,000 shillings. Dialysis per month costs 76,000 shillings. So it's better to pay for the anti-rejection medications of 40,000, that's in the first year, versus 76,000 of dialysis per month. But unfortunately, the NHIF does not reimburse for the anti-rejection medication. So the patients, once when they're transplanted, have to pay out of pocket. So it becomes challenging because now convincing a patient to go for a transplant, because they know that after they transplant, they have to fork out 40,000 every month, which goes to 30,000 in the second year every month and 25,000. It is out of reach for many of our Kenyan citizens. So most of them opt to remain on dialysis.
Okay, and that's one of the challenges that is hindering the access to quality services as far as kidney replacement therapy is concerned. The cost.
The cost.
Who is paying? Is the patient who is paying out of pocket, not the maybe covers insurance? So for the dialysis, it is the National Hospital Insurance Fund that pays for it. For those who are on the NHIF, they pay 500 shillings a month, but then they get the 76,000. For the kidney transplant, the NHIF only reimburses around 500 to 600,000.
Initial transplant.
The transplant itself, but the actual cost of the transplant is between 1.6 to 2 million Kenyan shillings. So the rest of it, either the private insurance, if they have a private insurance funds, or else the patients have to come up with the money themselves. Then after the transplant, you have to be on follow-up. Initially, it is once every week for a month, and then monthly if there are no complications. The cost comes to around 40,000 a month in the first 1 year, every month. Then after the first 1 year, then the medication dosage is reduced, and then it goes down to around 30,000, and then in the third year, it comes around 25,000 a month.
Is there a point that the patient gets to get off the anti-rejection medications?
No, and this is a very important point, because people feel that once when the transplant is done, then that's it. No, that is not it. you have to be on medications for the rest of your life. You have to be on regular follow-up. Eventually, if everything is stable, in the third year onwards, you come to the hospital once every 3 months, which is much better than coming to the hospital twice a week.
Yeah, true. Now, I think this is important because are these surgeries being done in Kenya, the transplants? Because many patients will say maybe it's too expensive in Kenya, we need to travel to India, for example. Are we doing it in Kenya?
We have been doing kidney transplants for almost 2 decades now here in Kenya. At my hospital, MP Shah Hospital, I run the transplant unit. We've been doing kidney transplants from 2018. We did our audits. We have had 100% success rates.
100%?
Yes.
Okay.
So, a lot of facilities in Kenya are doing kidney transplants. And it's important that the message comes out and gets out to the Kenyan population that we are doing kidney transplants here in Kenya. And our outcomes are very good. Yes.
Okay, that's great. Now, when it comes to now the way forward about taking care of kidney health in Kenya, kidney health for all, apart from the individuals, you said screening, early detection, and lifestyle changes. At the systems level, we're talking about the government, maybe policies, human staffing, training, and so on and so forth. What will be the way forward so that we achieve, so that we don't get to 2030, 2040, where we have doubling and tripling cases of kidney disease?
So that's a very difficult but a very important question.
Yeah. Yeah.
So currently we have around 50 nephrologists for 52 million people. As I said, around 5 million people have some form of kidney disease. So you can work out the math. 50 nephrologists for 5 million people.
Okay.
There's one nephrologist for 100,000 people with chronic kidney disease. How is that feasible? It's not.
Yeah.
But thankfully we have an established institution in the country called the East African Kidney Institute that is training nephrologists in-house. It's affiliated to the University of Nairobi.
Yeah.
So which is a very good thing, and this is how we managed to reach 50. Initially we were just 30 a couple of years ago.
30?
Yes.
Okay, yeah.
The other important thing that I believe that the government should embark on is the screening programs at the healthcare facilities. It's very important to have regular screening programs.
Yeah.
It's very important to talk to the public about diet, about nutrition, about exercise. I did a study when I was doing my master's at the Aga Khan University, and it was basically looking at the prevalence of cardiovascular disease risk factors in school students. I selected schools in Nairobi from the lower socioeconomic status, and surprisingly 9% of the students were overweight and obese. 9%.
9%.
Yes. 9% had pre-diabetes. Majority of them were inactive because of the long hours of studying and homework and staying in class. And yes. So all of this predisposes them to developing diabetes, hypertension, kidney disease as they grow older. So all of this needs to be put from, the policies need to be formulated from the school curriculum all the way now, even at workplaces as well, whereby exercises should be very important in the schools.
Yeah.
They should monitor what the children are eating. Yes. They should have forums whereby people or the public is educated about exercise and diet as well. And
All right. Thank you very much. I think because of time, we're going to close our discussion. As your parting shot, maybe in just 30 seconds, maybe you can communicate to the viewers where they can find you and what will be your message for the World Kidney Day 2024. So
I am based at the MP Shah Hospital, and that's where I practice, and you can always find me there. As we say that the World Kidney Day theme is equitable access to kidney care for all.
Yes.
If you are at risk, like what we mentioned before, please seek medical attention. It's just a simple test that you have to do to see whether you have chronic kidney disease. One very important message is avoid herbal medicines, avoid over-the-counter medications, stay well hydrated as well, and eat a balanced diet, and very important, exercise.
Thank you so much. Thank you, Dr. Hussein. Thank you to every viewers who have stayed to the end of our show. We appreciate your support. And this has been Body Garage, the art of well-being. My name is Dr. Chepsi. We will see you next Thursday.
Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.